projects about whether our criminal justice system should use drugs and other biological interventions that act on the brain to try to prevent criminals from reoffending. So there are a couple of interventions that are already used. One is chemical castration. So this is an intervention where sex offenders are given injections of a drug that suppresses their testosterone levels to the levels of a boy pre-puberty, and this suppresses their sex drive. And this is used in some countries to try to prevent sex offenders, typically pedophiles, from reoffending. The other main example of a neurointervention that's already used in criminal justice is methadone treatment, which is a treatment for drug addicts, typically for heroin addicts, that helps to treat their drug addiction. And in some cases, that's been used to try to prevent criminals from reoffending, because obviously a lot of crime is driven by drug addiction. One model would be that an offender that is in prison would be offered early release from prison or parole on the condition that they agree to undergo some kind of treatment program that might include a psychological element, but might also include a pharmacological element. So one concern is about consent. Suppose we were to offer offenders the choice between being released early from prison and undergoing a neurointervention, or remaining in prison for their full term. In some sense, the offender would be agreeing to undergo the neurointervention, but it's not clear that that agreement would meet the normal requirements for free and informed consent. If the alternative is that the offender has to stay in prison, perhaps in very bad, very harsh conditions, you might think that the offender has been coerced into agreeing to the neurointervention, and many people find that problematic. But of course, it's not clear that we should expect the same. We should try to meet the same standards of consent in the criminal justice system as we would in medicine. We already lock up people in prison without asking them for their consent. We subject criminal offenders to all kinds of interventions, community service, probation regimens, in some cases psychological rehabilitation programs, without getting their free and informed consent. And it's not obvious that we should treat neurointerventions differently just because they have a medical aspect to them. So I think the most serious concern, and in a way the most interesting concern, is about mental interference. So most of us would think that it's wrong to hypnotize someone without their consent, or to brainwash someone without their agreement in order to get them to do something. And one explanation for why that would be wrong is that it involves interfering with their minds in some way that is ethically problematic. And maybe it violates some kind of right to freedom from mental interference. So one of the reasons I think why this topic raises some interesting and difficult ethical questions is that it lies at the intersection of criminal justice and criminal justice ethics on the one hand, and medical ethics on the other hand. In general, medicine and criminal justice are areas where we accept very different values. For example, there's an idea in medicine that we should, as much as possible, respect the autonomy of patients, whereas we don't give anywhere near so much weight to offender autonomy within our criminal justice systems. So it's likely that psychiatrists, for example, would be involved in administering the kinds of interventions that I'm investigating. But you might think that psychiatrists have specific professional obligations to act in the best interests of their patient and to respect their patient's autonomy. That would be in some sense in tension with, certainly with the compulsory use of neurointerventions. So when I talk about this topic to psychiatrists, they often raise this concern. They say we don't want to be acting as tools of the state or tools of the criminal justice system. We want to be acting as advocates for our patients, like we do in most areas of medicine. And I think there are some genuine concerns here, but I think it's also important not to overstate them. There are all sorts of ways in which doctors are already required to do things that don't involve just putting their individual patients first, but also involve thinking about the wider interests of society. So, for example, forensic psychiatrists are already widely involved in risk assessments and deciding whether either psychiatric patients or incarcerated criminal offenders are safe enough to be released to the public. Similarly, psychiatrists and other doctors often act as expert witnesses in court cases. They may act as people who are imposing interventions like vaccination or treatment or quarantine in cases involving infectious disease. Doctors are sometimes required to think about the costs of the treatments that they impose to ensure that the treatments are not too expensive relative to the benefits they have for a patient. These are all cases in which we already expect doctors to take into account the interests of society. So although I think there are some interesting conflicts here, it seems to me that these conflicts exist anyway. We have to accept that medicine is an ethically complicated area that involves conflicts, and we should find the best way to resolve those conflicts, but it's not a reason to completely refuse to entertain using medical interventions in this area.